So we're here today talking about, for this topic, for this session,
Yes.
the new Medicare cards that are coming out. Can you give us a little background as to why new Medicare cards at this stage of the game?
So America has turned to this big identity crisis, and anything and anywhere somebody will find you. So Medicare is trying to change anything that somebody could get their hands on and take your information. So what they have done is changed all of the Medicare cards to reflect a different number that somebody couldn't figure out.
Because the original HIC number
Yes.
was your Social Security
Yes.
number with an alpha at the end. So the Social Security number template is going away,
Yes.
and they're creating new cards with what?
So you have 11 characters, whether it be A through Z, lower, uppercase, it doesn't matter, and 0 through 9. So those numbers and letters will be together, and you will not see your Social Security number on those cards whatsoever
And they're
anymore.
randomly generated.
Randomly generated.
Okay, so that's a big change. So there's a number of things that affect both the office and the patient. Well, the first thing I guess we need to ask is, how is this being rolled out across the country?
So everybody is being rolled out differently in America. So depending on what area of America you live in, the northern, the southern states, so everybody will receive their cards in the mail at a different time. So that's where the offices are going to start seeing a problem.
Okay.
And that's what we're supposed to be there to make them feel okay.
So what does an office tell someone who calls up and says, my neighbor got a new card and I didn't? What's the proper response?
Proper response is, that's okay. There's no need to worry. You have till the end of the year to receive your card. If you start worrying in October, you haven't received your card and everybody else around you have, that's okay. We can contact the Social Security department and find out maybe what's going on for you. And the offices, operations, we can all help those patients as well.
Well, since we started with the patient, once a patient does have their new card, what is their responsibility?
Their responsibility is to make sure that the office receives their new card and that the information is correct.
So if you don't like the way your name is coming through on your Medicare card, you have to contact Social Security and have it changed.
Yes.
And our proper response is, yes, we will be very happy to change your name in the records once you've made the change with Social Security. Until you do that, we cannot.
Right. Yes.
Without any attitude, just nice and calmly, and yeah, we understand it's frustrating.
And we will have that information on Share Connect for access providers, the staff, so they know to give the patient the right information on who to contact.
But what about the office? What happens when a patient walks in and says, here's my new card? Now what? What happens in the intake side of things?
I kind of want to go backwards just a little bit. Why did I get my new card? So that's why we're doing a subject about this, is how can we make it smooth for the patient and easy, and then the patient doesn't get upset, because patients do not like change.
No.
And you will see it very, very quickly. They don't like change. We have to make it easy and smooth. Okay, I have your new card. All right, that's all I need. We scan it into our care tracker system or our current EMR system. We make the old one inactive, and we just upload the new one in care tracker.
So once it's uploaded into Care Tracker, it knows it goes to, because it's not the HIC number anymore,
No.
it's a different field.
Yes.
Okay, and that, folks, that has an effect on everything, billing, everything. Nothing goes out right if that's not right.
Yes.
Now, my understanding is that for the first year, Medicare will be taking both numbers up until a certain point. But after a certain date, the HIC number goes away. this new randomly generated ID number is what will be replacing your Social Security number, and it is to protect you.
Yes.
So we'll do everything in our power
Yes.
to make sure that our patients are protected and that we get our billing out properly.
Yes, and then just tell the patients also, please make sure to protect your Medicare card like it is your Social Security card moving forward.
Yeah. Yeah, just because it's no longer your Social Security number doesn't mean it's
Yes.
free and clear of anybody trying to get it. But there is a question that we have not covered, that it's important that our office staff know how to answer this question if it gets asked. And that is, I have this new card. Did my benefits change? Did my, what else has changed?
Absolutely nothing.
Nothing changes except the ID. Everything
Yes.
else stays the same. Thank you so much
Thank
for
you.
coming in.